To look at macroeconomics in healthcare, the first thing we need to look at is the consumption function. And so this is a very basic version of the consumption function, and it says that any income you have come in, any money you have come in, it has to be allocated between consumption, which is you spending it, and saving. And where the total consumption of all the money people spend each year is going to be their total production plus anything that's saved minus anything that's taken from savings. And when it comes to what gets produced, production is going to be whatever is consumed plus anything that's invested. Within the consumption function, the one thing we look at is the income elasticity. So how much more do we spend in relation to changes in our income? So the income elasticity measures how responsive expenditures are to changes in income. And specifically, it's the percentage change in expenditure over the percentage change of income. And what has been found is that typically income elasticity of healthcare tends to be roughly 1. For every 1% change in income, there's a 1% change in expenditure on healthcare services. Now, there are a couple things within the consumption function that need to be discussed. First is the idea of the permanent income hypothesis. So when it comes to your spending, a lot of people say, all right, you have to balance your budget, you have to balance your checkbook every single year. You have to always spend, you can never spend more in a given year than you make. It's not true. Everybody does it. Nobody has very few people have a balanced budget. So for example, you go out, you buy a home. Let's say that home is $200,000. Did you have $200,000 that year? No, probably not. You probably didn't make it that year. So what did you do? People do. They take out mortgages. And so, in that year, they spend a lot more than they make. And then over time, in those additional years, they should paying off what they spent before. So the permanent income hypothesis says that when it comes to your consumption, you don't just look at each year. You look at your total expected lifetime earnings and make your decisions, your lifetime spending decisions, based on that lifetime earning. So this is why people go to school. In years that you're in school with tuition, right? That's a lot of money you're spending. You have little to nothing coming in. So you're making a huge loss there. Well, how do you pay that back? Well, you pay it back over time through student loans. So that's the permanent income. The shared income hypothesis is about a household or a family. And it says that family income is more important than individual income. So for example, I have 2 kids, right, twin boys. They're 5 years old right now. When they come to me, they come in, end of the day, they want to have dinner. Right? Am I going to say to them, well, you know what? You didn't make any money, so sorry, buddy, you can't have anything. Right? You have nothing to pay for this. No, of course not. Now at the same time, with couples, they have joint checking accounts, right, when they're married. And the reason why is that money is all in one pool. You don't have one say, well, let's see, I made this much this year, you made this much, and so I can spend more than you. Right? Or you can't have that because you didn't make enough. No. Shared income hypothesis says that people and households, families, they make decisions based on all the money for that household. And that all that income for the household is used to cover all the expenses of that household, regardless of what individuals make. So economics is what is called a decision science. It looks at what decisions people make and why they make it. And with healthcare especially, it becomes very important to understand who gets to make the decisions individual versus a group. And in general, the more public the broader the scope, the more people that are affected by those decisions, the more public it becomes. So, for example, you cannot smoke in bars and restaurants in Philadelphia and most places. And the reason why that is because the decision was made on a higher level that people should not do it because there's negative effects to people who don't decide to smoke. So when somebody smokes, the people around them are affected by secondhand smoke. Another example of this is a lot of schools require the kids be vaccinated or have flu shots. Okay. Why do they do this? Well, because if one person comes in with the flu, all right, they make it likely that a lot of people can get the flu, all right, by spreading it. So, whereas things like a decision to, you sprained your ankle, go to the doctor, that's your private decision. So again, the larger the scope, the more people that are affected, the more public decisions tend to become. Now, when it comes to insurance, healthcare and financing is on a national level. So your access to health insurance a lot of times is dependent on the state you live in. But when it comes to where that insurance can be used, any state matters. So you can live in upstate New York, and you have insurance there. You go down to Texas, your insurance is still good there. Now there might be limitations based on your network, but it's still good down there. However, if you were to travel 2 miles north up into Canada, that insurance is now useless. So you can't use insurance in other countries. So when it comes to the borders, state borders, they don't really mean anything in the United States. But the national borders, that is what really affects, and that what really drives the limitations when it comes to insurance.